My name's Wendy Randall. I'm one of the consultant midwives at the John Radcliffe Hospital. If you haven't met me before on one of these Facebook Live sessions. The purpose of today's Facebook Live is just to answer any questions that anybody may have. I'm very aware that, you know, the staff and yourselves, we've all been affected by the announcements that were made at the weekend for a national lockdown, and like perhaps everybody in the population, there are some anxieties around that and what it's going to mean. So I thought it was really important for me to be available today to hopefully answer any questions you may have, and let you know how that has the potential to impact on your journey being pregnant through to after you give birth to your baby. So I think the main things that people are starting to talk about are, you know, is this going to affect what we're currently doing? And what I wanted to reassure you is that we're not going to make any changes, reactionary changes straight away, and that, you know, we've got some time before these measures come into play, and you know, we need to really consider what's the safest for you and the safest for your baby. So I will take your questions as they appear up, because hopefully they'll answer other people's questions too. So I can see that Lauren has straight away said, does the announcement change anything of the rules with regarding birthing partners? So Lauren, from word go, we have absolutely been clear that we think having your birth partner there with you is crucial for both of you in terms of the support. It is just still one birth partner. It's something we've not been able to increase apart from in incredibly exceptional circumstances, but it is very important that it's just one birth partner, but they are going to continue to be with you, and that's something even Boris himself mentioned in his speech on Saturday night, that we want to enable people to still have their birth partners with them in labour. So Liz, you have posted that you're due on Friday. When you come in labour, is your husband allowed to be in with you the whole time? So Liz, we're not making any changes at this point. We're waiting for our national colleges to advise us in terms of this lockdown, because the last time we had a complete lockdown, it affected many aspects of your pregnancy journey and birth afterwards. So at present we're keeping things as we are, and we're waiting for some national guidelines from that perspective. So at present, you know, when you come in labour, your partner is with you throughout the assessment to ensure that labour is established, and then stays with you for the birth of your baby. They then stay with you afterwards, whilst you are still in your chosen birth environment, whether that's one of our community units, whether it's Delivery Suite, whether it's the Spires, and it's only when you make that transition to a different ward area that your partner is encouraged to go home. So that's, yes, they're with you throughout your journey when you're in labour and birthing your baby, and then afterwards they're with you for a few hours until you transfer to a different area. And generally that can be anything from 2 to 4 hours, but it is something that you know, depends on where you go to after you've had your baby. So I'm going to take the next question from Rita, and you've said about birth and your birth partner. Hopefully I've answered that in terms of the birth partner questions, and the visitors after the birth. So Rita, we are we will be looking at all aspects of the service, but just now it is staying as it has been, that if you gave birth today, if you don't go home today, you would have had your partner with you in labour, and when they go home, when you go to the postnatal ward, if you choose to do that and not go straight home, then your partner won't then visit again today. If you're then going home tomorrow, So for example, if you birth on the Spires, quite often women go home within 24 hours, then your partner wouldn't come in and visit you tomorrow because they would be coming to pick you up later to take you home. But if you birthed today and you weren't going home tomorrow, you weren't going home until Wednesday or Thursday, then your partner will still at present have a 1 hour visit per day at a designated time that they can come and see you. And unfortunately, there are no other visitors. There are some exceptions to that rule, as I've identified before. We have people who have, who sadly suffer a bereavement, or people who are younger than 16, people who have exceptional mental health circumstances and under advisement from their mental health team, then they may have their partner for longer. But it isn't, we have to be quite careful about the amount of visitors coming in and out of the unit, and reducing that exposure between other women, other partners, and our staff to extra people. So whilst you are in hospital, it's only one designated partner, and only if you're not either given birth that day or going home that day that they would come to visit. So I hope that helps. Corrine, you said, does the latest government guidelines affect us being able to have our partner at scans? You have your 12-week scan this Friday. So Corrine, we're very much watching the space at present. We have decided, the Director of Midwifery, our clinical director, have decided at present to continue as we are until we receive other guidance which may advise us in another capacity. We are desperately hoping that we can still maintain the scans, but obviously that depends what the Society for Radiographers suggests, because obviously those are quite small rooms, the scan rooms, and the sonographer has to be very close contact for over 30 minutes. And there's over 100 people coming through our scan department every day. So it is a lot of people, which is why we were quite slow to implement partners being present at scans. But we absolutely have listened to women and know that that's a crucial time for them. So whilst other things may have to give, we're hoping that we will still be able to continue with the scans. But I won't be able to let you know for sure until we get to sort of Wednesday, Thursday this week. So I will absolutely make sure the Maternity Voices partnership have the most up-to-date message, around Thursday, and fingers crossed that everything is still okay for Friday. But we will have to watch this space and see what we're advised, because obviously it's about the amount of people that are coming through the unit. Lauren, I'm glad that makes you feel better. So Jessica, you booked for a home birth and you'd like the anti-sickness injection for the gas and air. You've been told different things. Some people have had to get a request prescription through GP, yours won't issue, and your midwife thinks that there is one in the home birth kit. Do you know whether it is or not? You come from Didcot. So Jessica, we should have an antiemetic for you. I think it's very important that I will contact your community midwife afterwards to make sure that that is available and that is at your home birth, in your home birth kit, because there's no reason that that cannot be added to your own birthing pack for you to have at home. So Jessica, I will get in touch with the Didcot team after today. And just if you could message me if your surname is different, if you could message MVP, just so that we can make sure I've got the right details for the community midwife team. So Melanie, I think I've just answered that question about scans. Hopefully we'll have a more definitive answer by Thursday this week. So Jennifer, you've tested positive for COVID and you're 24 weeks pregnant. Is there anything you need to be looking out for or concerned about for the baby? So Jennifer, I'm sorry, obviously that you have tested positive, and I hope you're feeling okay. It affects different people in different ways, but I hope it's not making you feel too unwell. Jennifer, you may find that your baby is you're at that point where baby's not quite perhaps established a routine in terms of its movements, and you may find that it's a little bit quieter. If you have a high temperature, baby will and you want to curl up and have a sleep, babies can be quite similar, but you don't have anything to worry about. Just manage your temperature by taking paracetamol if your temperature is high, because it's really important to keep your temperature down. So paracetamol doesn't do you or the baby any harm, unless obviously you have an allergy or a reaction to it, but please take it regularly to keep your temperature at bay. But otherwise, you know, plenty of fluids for yourself, just look after yourself, and hopefully you'll start to feel better soon. Or if you're one of the fortunate ones that hasn't had symptoms, then you know, again, it's just managing your temperature, keeping yourself hydrated, and making sure that you isolate appropriately to reduce the risk of spread. Vicky, you saying, are you expecting to change the rules on Thursday when you receive national guidelines, and how will we be notified of changes? So Vicky, are we anticipating a change? It's very difficult to say. Certainly the Royal College of for radiologists, the last time were the ones that said clearly about us reducing partners being present for scans. So if they did say that, then we would have to follow their guidelines, because they are thinking about their staff. And what we don't want to do is, we can't afford to reduce our number of radiologists, because we want to be able to offer the same amount of scans for everyone, and we don't want to stop doing our scans. So we're hoping desperately that we don't. We want to try and continue with what we're doing, and hopefully it would be one of the last areas that we would want to make a change to, but we are very dependent on professional bodies advising us what would happen. And I think with the news coming in on Saturday, it will take today, tomorrow for the national bodies to come up with a response, and we do have to follow that. So we're really under their guidelines. At present, the Trust has supported us to continue as we are until we receive any further notice. So I'm sorry that's vague, that it isn't accurately identifying your data, but we will get it out to you whichever way we can. We have been very fortunate that Oxfordshire Maternity Voices Partnership have given us this forum to be able to communicate with as many of you as we can. We'll obviously make our midwives aware. We'll have it on our Trust website as well. So if there's any changes, we absolutely will get it out there. So Mel, you said, is there an update as to when Wantage MLU can be open for births? So Mel, we're equally as frustrated as you are. Our staff are raring to go. We're all ready to open at the drop of a hat. Unfortunately, we're waiting for it to be signed off by infection control. So our estates department are in touch with Oxford Health, because it's actually Oxford Health who hold the estate for Wantage, and they have to sign off on the water supply to make sure that it meets infection control standards. So clearly it's not something we want to jump in and go, well, we're fed up waiting, can we just open it? Because we need to make sure that the water supply has been tested and it meets all infection control standards. So it's daily communication, trying to get this all signed off as quickly as possible. But honestly, we all can't wait to get it opened. The midwives are champing at the bit. We're pushing from our side as much as we can to try and get it signed off. So hopefully Wantage will be open any day now. And again, as soon as we have, we're going to get it out there to make sure that you know that it's happening. Okay, so Jessica, same surname, thank you. So I will contact your community team and we'll see about getting something dropped off to you. Naomi, you said, is your partner allowed in the MAU with you before you are admitted into labour ward? If not, are we left alone in MAU room while things are being sorted, or will there be someone with us? So Naomi, what we've done is In the majority of cases, your partner will come in. When you're coming in for a labour assessment to the maternity assessment unit or the Spires or any of our community units, we encourage your partner to come in with you. The only time it's different is if we have, in our maternity assessment unit, we have a small waiting area. And if that waiting area is busy and we can't enable people to be socially distanced in that area, then we would encourage your partner to wait outside. Now, it is something that if you want to stay together, what some people are doing is leaving their phone number and waiting outside with their partner, and then the midwives are calling to say that it's time for them to have their review, and then you can come in together into the room. But it is just in that actual waiting area, it's quite a small space, and if there's quite a few people there, because it isn't just labour assessments, it's people with raised blood pressure, reduced fetal movements, feeling unwell, what we're trying to do is reduce the spread. So yes, they can still be about and available. We're trying to keep you all together, and if they can stay in the room with you, that's preferable until you go to your chosen birth environment. So Melanie, you asked a few weeks ago if your partner is allowed to come with you for the removal of your suture, as this will be done in a delivery suite room. It's due to remove next week, but I've heard nothing more. Miss Rimpey, Miss Curry both believe I should be allowed my birth partner. And so in terms of your birth partner bit, before we talk about the going into labour, yes, for women that have to come to our delivery suite for if they think a baby's in breech presentation, for people who are having their stitches put in or stitches removed, partners can still come in with them. That's absolutely fine. In terms of the chance of you going into labour, it's very different. Once you've had a stitch removed, there are people that will go into labour, but not within literally at the point of it being removed. I don't know what the percentages are. Miss Curry and Mr. Impey may have those more exact percentages, but there will be some women that go into labour within a day or two having their stitch out, and other people who won't, because everybody's different. But I think at the point that you're having your stitch out, be prepared, have your hospital bag packed, so that you're prepared if you do go into labour. So Pasqualina, you said you're 34 weeks pregnant. Will a TENS machine be available for me at the Spires, or do I need to buy your own? So you don't need to buy your own. There are companies that you can rent a TENS machine from, but we don't actually have a supply of them on the Spires for you to use. So if it is something you're interested in, most companies will lend you one from about 37 weeks pregnant. You tend to pay for a month, which covers most people, but it is something that you have to provide yourself. So Elsa, you've said that you had your sutures out last week and you had to come in alone. I'm very sorry that happened, Elsa. We have encouraged people to have their partners with you, and I will follow that up with the delivery suite team, because we did agree on that. So I'm sorry that you had that experience, and we'll see what we can do to make it better for other people. But I'm sorry you didn't have that support. Yes, and I agree with you in that comment, so I am sorry about that, Melanie and Elsa. Naomi, you're saying, do I need to notify my midwife I've had COVID, just for them to note it down? So Naomi, if you're having any, your midwife can record it in your notes the next time she sees you. It's not something you have to notify her in advance. You only have to notify people if you were due to have appointments. So if you were due to have an appointment with your midwife, if you're due to have a scan, or if somebody asks you if you have, we want you to tell us if you have any concerns about your health or your baby. And if we were to invite you into the hospital, we need you to tell us when you tested positive for COVID, so that we know whether you need to have emergency care in an environment that we have for women that are COVID positive, or whether actually care can be delayed until after you've isolated. So thank you for raising that, but we do need to know in that sort of 2-week window if you've had it and need other care. So Sarah, you're saying you're a week overdue now, so we'll be booked in for an induction at my 41-week midwife appointment tomorrow. Are partners allowed to come in for the induction with us, or only allowed into the hospital once live labour starts? Hopefully she'll come before then. If I do have an induction, is that done in the Spires or downstairs? You think the latter. Okay, so a few questions there. So at present, Sarah, what we have done is we've enabled people, because our induction process is done over 2 days. So if you're low risk, you come in for 1 day and you have the Foley catheter put in, the catheter with the balloon. You're in for about an hour and then you go home. So what we've done is we've enabled partners to come in for that so that they can support you for that first part of the induction. And then when the catheter's in, if you and baby are well, then your partner and you both go home. If we had any concerns about you or the baby and felt that you weren't then suitable to go home and you went onto our antenatal ward, it's at that point that your partner would go home without you and you'd stay in the hospital. So our induction team do say put your overnight bag in the back of the car just in case, but it is the majority of people who are planning to go home will go home. The following day, when you come in for the second day of your induction, that's with the hope that the balloon has fallen out, or else we would remove it, and then we go to the point of breaking your waters. Now at that point, we currently ask your partners not to come in, because that should ideally happen round about the time. So you'd be given an appointment, say at 9 o'clock, to come in for that to happen. And ideally, we monitor baby, we break your waters, and over the next couple of hours, your contractions will start and you can go to either the Spires or delivery suite. Or if you need to have the next part of the induction, which is a hormone drip, then you'd go to delivery suite for that. And it's at the point that you then go to delivery suite or the Spires, whichever is the right area for you, that your partner would come in to join you. So they can't come in for that first bit because it can be a period of time. And we also have had, more so over the last week, but we have had a very busy week, and some of our inductions were delayed, which I know is horrible. It's lots of sitting about waiting and you haven't got your partner with you, but it is really important that we keep everybody as safe as possible. And if you have lots of people going into labour naturally, what you don't want to do is put extra people into labour, because we want to make sure that you have the best care and have a midwife with you at all times. So the second day of the induction is a little bit more time spent without your partner, but at the point that we feel that you're in labour, absolutely they're encouraged to come in and be with you. So Vicky, if partners aren't able to attend the scans, would other ways of them attending be considered? Your partner would like to hear about his baby and have the ability to ask questions. So again, Vicky, we had a lot of challenges with this when it first started, and people wondered about being able to have their partners available virtually, and to enable them to ask questions. The radiographers, the national group, actually said that they found that the use of mobile phones during the scanning was more disruptive, and they wanted the sonographers to concentrate on what they were doing, and not have the challenges of that. So the last time when we had the lockdown, it wasn't something that we could enable to happen. We did enable it for people who they felt like there might be a concern over the growth of the baby, and then they went to our fetal medicine unit, and at that point, not actually during the scan, but they could then be present virtually for questions with the doctors about their findings afterwards. So we appreciate that people would really like to be part of that scan experience. One of the things we did introduce was marking down the sex of the baby. It's not an exact science and it's not guaranteed, but we have included that on the scan reports for people that want that to be present, so that they can then discover that together afterwards. So you can keep the scan report separate when they print out, and then reveal it together, so that you can share in that experience of discovering the sex of your baby together if you want. But we are absolutely governed by our professional bodies, and everything that we do is not because we're trying to be cruel or prevent you from sharing in what is a truly magical experience having a baby, but it is about just trying to keep everybody as safe as possible and make sure that we do our jobs as well as we can. Because although the scan is such a fantastic experience for you and seeing your baby for the first time, etc., it is a screening process, and we do have to make sure that we're happy, that we've looked at every part of the body to make sure that baby is developing well. So I think that's where the College of Radiographers has said, we really mustn't have any distractions at that point. And I know you might think that's, how is that different? If my partner was actually present, they'd still be asking the questions. But I think it's just using this other media source. There's concerns about not being able to get signal, and lots of sort of attention around that, because these rooms are very small as well, and we want to make sure that we are as efficient as possible with our time, to be able to accurately assess the well-being of your baby. So Pasqualina, you say, are there any changes to caesarean sections and partners' attendance in light of the announcement on Saturday? So Pasqualina, no, again, we feel that that's, again, the birth of your baby, having a caesarean section. So we are very mindful about making sure that partners are present for caesarean sections as well. Sometimes after a caesarean section, the time that you get together as a family can be shortened, and may only be an hour or two at the most, and we're sorry for that, but because of our recovery process and having people come through the service, it may be that we have to do that a bit quicker. But we absolutely are passionate about them being there for the birth of your baby. The only time it's different is if you have a general anaesthetic and you go to sleep to have your baby, then your partner isn't present, but will meet the baby as quick as possible after the baby's born. Unfortunately, sometimes before you, because you're asleep, but it is something that comes with the general anaesthetic. So Natalie, you said, do VBACs, so that's women having a vaginal birth after caesarean, have to be on the delivery suite, or can they be on the Spires? And can these women still go overdue? So Natalie, when we have a discussion with you about place of birth, in general terms, we recommend women birth on delivery suite and have continuous monitoring of baby's heart rate. But we are aware that not all women want to have that plan of care, and if it's something that women want to consider, having their baby on the Spires or at home, then we advise them to tell the community midwife, and they will arrange for you to see one of the 3 consultant midwives, because we have a new consultant midwife just appointed, which is incredibly exciting. Heidi started today. So you would attend a mode of birth appointment to discuss that further. What we want you to do is to make an informed choice. Everything is a balance of risk. Some people feel that it's safer for them to birth their baby on delivery suite, and some people feel that it's better for them to birth on the Spires. And it's absolutely a conversation that we have with you, and ensure that you have the information to make the best choice for you and your family. In terms of going overdue, yes, we don't recommend that women birth their babies any sooner unless there's another medical indication. So just the fact that you've had a previous caesarean wouldn't be a reason for us to recommend an earlier gestation for you to have your baby. So you'll be given the same opportunities as somebody else. And then obviously if you decline an induction or cesarean section, whichever that may be, at the time that we think your pregnancy should come to an end, then obviously again we'd have a similar conversation with you to weigh up the pros and cons for which way you would rather continue the plans for the birth of your baby. So Natalie, I think the message is, if you think that if you are in that position, you want to birth in the Spires, please get into contact with your midwife today, tomorrow, and arrange for her to refer you to the consultant midwife clinic. So Siobhan, you said you've missed the beginning of the session. You're currently 39 plus 5. As long as we go into labour naturally, at what point will partners be allowed to come into hospital with you? So yes, we did address it, Siobhan. It's just they will come as normal. There isn't any change to that. So when you come up for a labour assessment, your partner will come with you. So Vicky, you said, thanks Wendy, nice to know that partners aren't allowed. There were any problems, they'd get an opportunity to speak to the doctor. Yes, so at that point, if there are things that we are concerned about, that they will have the opportunity to take part. So Sarah, you said, oh, thank you. You said that that these have been quite helpful for you, and they've been informative. So I'm really pleased that they're helpful for you. Isabel, you said a water birth still possible currently. Absolutely, we've never stopped it. We're trying to think about the key things. We absolutely are listening to you, and your Maternity Voices partnership group, we talk to them every week, more so if we need to, listening to what your concerns are and trying to address those, because we absolutely appreciate that it's that this is an interesting time for everyone, isn't it? We've all got things in our lives that this horrible pandemic is having an impact on, but our main thing is for us all to keep as safe and healthy as possible. Let's see if there's any other questions. So Naomi, you said you have a fetal medicine scan next week. Following the government guidelines, if partners are not allowed for routine scans, does that apply for fetal medicine ones too? Yeah, so it will. Obviously, Naomi, this applies that if partners can't be present when you're having the consultation with the doctor after your scan. During the fetal medicine scan, during any scan, it's the sonographer, the doctor who's doing your scan, is incredibly focused. They've got so much detail to look into and make sure that they're happy that this baby is well grown. If you're having a fetal medicine scan, it's even more so, because they think that they've potentially seen a problem and they really have to investigate it further. So our doctors who predominantly do our scans in the fetal medicine unit are so focused on the tiny detail that they very much, there's not so much communication at the time of the scan, because they're concentrating and talking, and quite often there might be another doctor that they're talking through their findings with. So although it's about you and your baby, it's really important for them to have that understanding of what's going on. And then after the scan, they would then talk to you about what they've found. And they feel it's really important for you to still be, your partner to be part of that if they can, but again, it may be virtually. So on FaceTime or whatever social media you use at that time, so that you can answer questions, or via the phone. So don't worry if you haven't got FaceTime or WhatsApp or whatever other people use. We can use the phone and put it on speaker so that you can hear everything and ask your questions. Vicky, you've asked, were any home births cancelled during the last lockdown? Just trying to think about how likely my home birth will be to go ahead. So Vicky, we are so proud of our staff and our community midwives. Have been amazing, and actually we were one of the few units that actually saw an increase in home birth rate and births in our community midwifery led units. So we were overwhelmed by people wanting to birth in community, because for the majority of women it is incredibly safe for you to birth in the community, but our community midwives were working really hard to enable that to happen, which I think is so exciting. So really don't see home births stopping. The only time it's been a challenge is actually we've had a couple of people that tested positive for COVID, or a family member did in the home. And that makes it incredibly difficult for us. You know, the national recommendations is if you test positive, or somebody that you live with does, that we treat you like you are COVID positive, which means birthing on delivery suite with continuous monitoring of baby's heart rate. And, you know, potentially there's more risk if you decide to continue with home birth. But actually we then have to think about our staff coming into that environment as well, and it's very high risk for them. So that's when it becomes a little bit more difficult to support the home birth. You know, I think the majority of people will choose the safest option for them and their baby. So, you know, we will continue to provide the staff for your home birth. You just need to keep yourself as COVID free as possible, because that's the only thing that really can affect it. And you'll probably see I'm sitting on in the Spires. I don't know if you can see, there's a bed behind me. This is one of our postnatal rooms, just because our birthing rooms are all busy today. So lots of people having babies today. So Chloe, you said you're currently 40 weeks and 2 days with an IVF pregnancy. Would it be okay for an induction at 41 weeks if she hasn't made her appearance by then? You've been told various different thoughts from 2 to 3 different midwives, with no clear clarification yet. So Chloe, I think you know, it would be good for us to have a conversation about that, if that's something that you're concerned about, because one of the things, if you're worrying about when the baby's going to happen, is you won't be relaxed enough to go into labour, and we need you to feel nice and relaxed and in control of what's happening. So can I ask you, Chloe, to message into OMVP, and then I can have communication with you, so that we can go through that with you, and look at the pros and cons of you know, an earlier induction or continuing for spontaneous labour. So those will be one of the conversations that we'd have as consultant midwives with you. Chloe, you said, sorry, one more question. Why are first time mums to be not seen at 40 weeks? Your next appointment is 41 weeks. So Chloe, I thought we had reintroduced aspects of that pathway. So again, as part of your message to me, can you just put that in there? Because I'm just not sure why that's not happening. So I just need to clarify that with the team that are leading on the community changes, because I thought we'd reintroduced that aspect of the service. So we just need to make sure that you're getting the right care. So if you could put that in your message when you message me about the induction, that'd be great. Stephanie, you're asking, are partners allowed during the stretch and sweep? It's not something that we're not advocating partners being present at any of the community antenatal checkups at present. That's because, again, it's about exposure to members of staff, to lots of different people, and him being exposed to us unnecessarily as well. So the stretch and sweep examination would just be part of your community antenatal check, and would be part with your community midwife, without your partner present. So Isabel, you said, speaking of postnatal rooms, are partners able to stay on the Spires after the baby is born? Currently, this is my first time, so no idea how things usually work. So Isabel, I know it's like torture. I'm showing you this lovely double bed, and non-COVID times, absolutely. The reason we got the double beds is to enable your partner to stay with you and be much more comfortable than they used to be sleeping in a chair. But I'm really sorry, due to COVID, we aren't able for partners to stay when you get into the postnatal rooms. And that's, again, just about reducing the chance of you being in contact with different staff groups. So again, it's about contact with you, with our staff, and our staff with you. So I'm sorry, it's not something that we can support at present. Louise, you said, are partners allowed for the whole birth still? Yes, I think, Louise, if you want to catch up on this Facebook Live later, I think I went into quite a lot of detail about that, so hopefully that helps. And you've asked again about the leave after 2 hours after the birth. So the leaving after the birth depends on when you move to the next clinical area. So if you birth on the Spires, you'll be in a room, in the birthing room for a couple of hours while the midwife does paperwork, etc. Before she transfers you to a postnatal room, and it's at the point of transfer to the postnatal room that you would, your partner would then go home. If you're on delivery suite, again, it can be a good few hours before you then transfer up to level 5 or level 7, and it's at the point that you transfer to a different area that your partner will go home, and that can be anything from 2 to 4 hours. If you go to theatre, either for the birth of your baby or after the birth of your baby, you go to our observation ward, and that ward has quite a quick turnaround. And so to reduce the risk of exposure, it may be only an hour or maximum 2 hours before you would then leave. Your partner would then leave to go home, and that's just a bit quicker because that environment changes a lot, and there's more risk of exposure to other people, to you and to them. So I hope that answers your question, and I think that's the end of the questions. The only other thing I just wanted to add, so we've had some feedback from people about student midwives, and saying, they don't understand why, they can't have, say, a second birth partner, or they can't have their partner at their antenatal checks when there's a student midwife there. And to answer that question, we have to train the midwives for the future. And that's so important, because I won't be doing this for another 10 or 20 years. There are people younger than me, and there are people that are older than me, and we need to have the next lot of midwives available to be able to look after you. And if they're not present, midwifery is not a job that you can learn virtually. You actually need to be with women to see the physical checks, to put your hands on, and it's not something that they can learn by not being present. So whilst we appreciate it is another person present, and you would rather have your partner there than have the student midwife, it is about having the student midwives getting their learning and their training, which is so important. We are sorry, and it may seem unfair to some of you, but it is so important that our midwives get that exposure, because already they've had a few months when COVID first started that training was affected. And I suppose, going from the government's point of view, looking at universities continuing, looking at children still being at school and in nurseries, the same applies to anybody who's a student. Whether you're a medical student, a nursing student, a midwifery student, a paramedic student, they all still have to be there because they've got to learn. So I hope that helps to answer the question about students and why they're present when your partner, or perhaps a second birth partner, couldn't be present. Lots posted now. Clearly I talk too much. Naomi, you've asked, do we get a COVID swab while we're in labour? Yes, we strongly recommend that you have a COVID swab if you're going to stay in the hospital. So it's part of your admission in labour. Obviously, if you're having a baby come through the door, we will do your COVID afterwards, and that's to help you keep you and your baby as safe as possible after the event. For women who are having a planned cesarean section, they will have a COVID swab as part of their pre-operative check a few days before the baby is born. Katie, you said your daughter was born 3 weeks ago. You gave birth at 2 a.m. and was home by 6:30. You had a complication, a shoulder dystocia, but you feel fine in yourself and baby's okay. You can go straight home, and your partner stayed the whole time. So Katie, I hope you and your family are well. That's great news, and goes to show that we do try to get people home as soon as we can in hospital. Zoe, you've asked what happens on discharge. Is partner able to come in and help with carrying baby in bags? So Zoe, what happens is that your partner comes to the door of the hospital where the maternity assessment unit is, and waits there. and we, one of our maternity support workers, will help you with the baby and your bags down to that point to meet them, where baby will then be strapped into the car seat and you can all go off home. So unfortunately they can't come up into the ward to help you, but please be reassured that we do help you with your bags, etc. Thank you for your positivity, Naomi. And you said, if you're not on the ward, my partner was allowed to leave to go and get the car seat and come back in. Yeah, so you know, we're not there to be cruel. You know, basically your partner will be allowed to go out to get a bag or a car seat to be able to take the baby home. Our main things is we have to reduce the footfall through the unit. So we ask, if your partner comes in labour, to stay with you in labour, you know, bring food supplies. I mean, we'll provide drinks and things. We'll provide a toilet for them to use, but we want to reduce them coming in and out of the hospital. If your partner smokes, now would be a great time to get some patches, because again, you know, it's about the amount of times that you go in and out that cause a problem. So, you know, do think about ways that you can help. I don't think you quite have to have them catheterized, but and they definitely will need their fluids. So there is a bathroom, but we're just trying to reduce the amount of free flow and contact with other people. And that's what the government lockdown's all about. It's about us trying to reduce that contact and risk of infection. Mel says, can catching COVID-19 affect your pregnancy? So again, Mel, it's just about making you feel unwell. And if you have a high temperature, it's really important to bring it down. But you know, the studies, the cases that we've studied that have happened the world are showing that there isn't an impact on the baby. The baby is protected when you're pregnant, but you do need to manage your temperature. That's the main thing. So I think people are always a bit scared about taking tablets when they're pregnant, but paracetamol is safe to take and should be taken regularly to keep your temperature at normal levels. So Sarah said, our car seat is one that's secured into car by seatbelt and doesn't have a handle to carry it. Do we have to bring car seat into hospital? Will be chunky and hard to do. No, Sarah, we'll probably get you to come up into the dropping off bay with the car. There's 2 20-minute bays outside the door near the ambulance, and that's fine. Because your partner will literally be meeting you at that front door anyway, so they just need to be able to help make sure the baby's safely in the car seat. Nicola, you said, how do you plan to manage the 15-minute COVID tests for partners of women in labour coming to hospital? Also, you read that having a student present in any part of labour was optional, a choice for women. So Nicola, in terms of the 15-minute COVID test for partners, it's not something that we have readily available at present. So, you know, again, these resources that the government talk about having these quick tests and things aren't something that are as readily available for us in the hospital as perhaps, I know you can go and have a Boots test and pay £100+ for it. But we haven't got that at this point in the hospital just now, and we're not testing partners at present due to we want to ensure that we have enough tests available for other people. And in terms of students being present in your labour, absolutely. You know, you do have a choice, and you can decline to have a student present. I was thinking more in terms of antenatal care. People have said that they feel it's unfair that partners can't come to their antenatal checkups because the students are there, and that was me just trying to explain that they are there to learn, and they would generally be part of the care. I mean, obviously, if you didn't want them to be present, then you could specify that, but obviously it doesn't then mean that your partner could come in and be present. So it's not an either or, but of course you can decline for a student to be present. In terms of your labour and birth, it is something obviously you have to consider how you feel about it, and if you don't want a student to be present, then please make sure that's documented in your birth plan. Ashley, you said, can your mother come to your next scan on the 23rd of November? Ashley, I would say, again, it's watch this space. It is, we don't know what's going to happen. We're hoping partners can still be present at scans. And if your chosen partner is your mother, then that's fine, but it wouldn't be for two people, it would only be for one person. And obviously it depends, like I said, what the national picture is in terms of partners being able to attend scans, that we should know more of hopefully this week. But and if we continue as we are, then you can have one partner present for a scan on the 23rd of November, but I just can't guarantee how long we'll be able to do that for. So Kate, you said, thank you for the clarification about students. Your student midwife was the best person in the room when you had your first baby. Oh, that's fantastic, Kate. That's really good news. You know, generally they're fantastic because they're so motivated. Not that we're not motivated, of course we are, but they are, you know, fully engaged and want you to have as positive an experience as possible. So thank you for that. Also, you get two midwives really for the price of one, which is quite good. But we're probably biased. Jane, you said, does Delivery Suite offer other forms of induction, for example, gel or only Foley's? So Jane, the majority of women, we recommend that they have a Foley's catheter. Because it's generally the baby's happier. So it's a more gentler way of inducing a labour, and you're less likely to get something called hyperstimulation, which can upset both you and the baby, which is a side effect of using the gel. So the current evidence base and driving lots of organisations is to use a catheter, a mechanical induction. There are some women that it's not suitable for. Those are very, very few, but for those women we do use Prostin. So it's not that Prostin is never used, it's just the current, the most up-to-date research evidence is showing that mechanical induction is actually better and a gentler way to start your labour. But it is a choice, and if you choose to decline it and would prefer the Prostin, then again it's about giving you the information to make that informed choice. Louise says, if I get sent to the JR from Wallingford Maternity Hospital at any time in an ambulance during labour, can my partner come in the ambulance? I think generally, Louise, what happens is that the midwife comes in the ambulance with you and your partner would follow in the car, because this enables them to be able to have their own transport as well, and it will be important for the midwife at that time to be concentrating on you and the reason for transfer, really. So, generally partners come behind in another car, and the midwife with you will come with you in the ambulance to provide that support. So Nicola, you're saying, sorry, so does that mean partners can still come in for an assessment and stay with us if we are in active labour? Yes, absolutely. And I think I've come to the end of our questions, and we've almost been on the go for, I think, 55 minutes now. I'm just looking at my list. I think that was everything I wanted to cover. So hopefully from this update you know that we're continuing as we have done for the last few months in terms of partners and visiting, and that may change depending on what the government suggests. So that is an evolving picture, but as it changes we'll make sure that we get it out in every possible way we can so that you know what is happening. She's just sneaking in some questions coming in. So Ben, you've said we're hoping for home birth. Your wife's due date is the 7th of January. Will the lockdown possibly affect this? Thanks in advance. So again, Ben, like we said before, our home birth service continued to run really well through the first lockdown, which was obviously much more than we had before. And our aim would be to continue it. I think home birth is an amazing and fantastic thing for people to do, and as long as you're low risk, it's one of the safest things to do too. So thank you all very much for today. I hope it's been helpful. I just wanted to reassure you that we do care, we are listening, and we do want to make this the best outcome for you and your family. So we're really sorry that you've been upset by the government's news and it's caused the level of anxiety, and it has for everyone. I hope to goodness they keep my daughter at school and university. But you know, it is really important that we continue, and we will make sure that we keep you up to date as much as we can. So thank you to everything that you're doing for keeping us all safe, and we will make sure that we post as much as we can with Maternity Voices Partnership and our main website, and get the news out to you as it happens. But bear with us, there's not going to be any changes, I wouldn't anticipate, before lunchtime on Wednesday anyway. So I suspect if there are any changes, it would be towards the end of the week. So thank you all very much for your patience, and we look forward to seeing you. I've met some lovely people who've met me on Facebook when they've come in to have their baby. So it's been advantageous, hopefully, for all of us. So take care and have a good day.